Hi, everyone. So I'm looking at there. Welcome to our merit rounds. And I am Dr. Ellen Bilgic, and I'm an education scientist in the Department of Pediatrics and at Merit, which, for those of you who don't know, stands for Master Education Research, Innovation, and Theory Program. And Merit is an education services program that is within the Faculty of Health Sciences has a vision to grow a community of scientists and clinicians to advance health professions, education research, and applied science. And as a part of our vision here at Merit, we have created a visiting professorship that invites prominent scholars with expertise relevant to health professions education to engage in part-time, year-long residency at Merit. And the goal of this visiting professorship is to build a particular knowledge base, skill set, or capacity in the Merit scientists and community. Now we're excited to be hosting Dr. Cheryl Poth for a series of visits to McMaster over the course of 2 years, of which around 1 year has already passed, I would say. And her portfolio brings a diversity of quantitative and qualitative methodologies in acquiring improved competence in mixed method methodology research. And Dr. Poth introduced us to mixed methods as our round speakers for 2 of the rounds. First in May 2023, which is basically a year ago, focusing on what mixed methods offer health researchers. And then a second round in November 2023, focusing on distinguishing credible mixed methods study from other research approaches. And today she will further guide us in our journey in learning about mixed methods. Now, before I say a bit more about Dr. Poth, who's also, as I mentioned, our today's speaker, I would like to make a land acknowledgement. And today's education rounds is hybrid, and many of us in this event are connected by the land on which we work. So I wanted to take this time to recognize that McMaster University is on the traditional territory shared between the Haudenosaunee Confederacy and the Anishinaabe Nations, which was acknowledged in the Dish with Wampum Belt. And the wampum uses the symbolism of a dish to represent the territory, and one spoon to represent that the people are to share the resources and of the land and only take what they need. Now, before leaving the stage to our esteemed visiting professor, I will provide a very brief introduction. So the title of today's education round is Why and How Are the Design Possibilities for Mixed Methods Limitless? And Dr. Cheryl Poth is a professor in the Center for Research and Applied Measurement and Evaluation at the University of Alberta, and was a founding board member and president of the Mixed Methods International Research Association. Now, with increased interest among researchers in understanding and using mixed methods research, Dr. Poth will examine the multiple entry points for mixed methods designs and discuss specific strategies for helping researchers navigate key decisions necessary for creating a coherent study design. Now, during the rounds, for those joining over Zoom, feel free to use the chat for comments and questions. And we will also have a Q&A period at the end. You can also ask questions by using the hand raising function. And for those joining in person, you can simply ask your questions at the end or throughout, depending on Dr. Poth's preference. So without further ado, please go ahead, Dr.
Oh, well,
thank you.
Well, thank you for having me. You can tell that we were on the same wavelength, because you'll see here that I thought, oh, we'll situate just as we are like working here, but that's aim it toward it. There we go. Yeah. We'll see. Or we can, just do it this way. Right. I don't. That is okay. We are, so I had actually just started as well going, okay, so I was here a year ago and here's when we started. And then, in the fall we were here. And so today we are going to go just a little bit into this next piece, into different ways of being able to design. Oh, we're just figuring this out. About that. Yeah, that's okay. We can do it again and we can get it going. Here we go. See? Yeah, that's all right. So this was this idea exactly what we said like a year ago. We kind of went into the mixed methods piece about requiring the integration of qualitative and quantitative, and this idea that mixed methods does need expertise that is in addition to qualitative and quantitative research. So that was important. And in the second, we talked a little bit about some of the distinguishing characteristics that and how they might look in publications. So if you remember, we talked about having the need for integration, we talked about having designs where integration is apparent, we talked about evidence of integration, and then we talked about that value added piece about mixed methods and making that explicit. So today, I want to introduce you to this idea about, we're talking about a mixed methods way of thinking earlier today, and maybe an integration mindset. So if we're not talking about integration, we might not be talking about mixed methods. And then a little bit about how we can get to some design innovations today. So that's where we're going to go for the next half an hour or so. So we will all work along. So this idea about navigating possibilities and this limitless idea. I mean, in some ways, mixed methods can be challenging, just like any research is, because we have so many possibilities of design. And how do we actually decide how we're going to go forward on a study? So today I want to talk about how we can almost explore those possibilities so that we're making a decision that's based on the best possible, perhaps, outcome within our different contexts and our conditions. So I do think that HPE, or health professional education, can benefit from a mixed methods approach. Yet making decisions can be challenging. I will kind of talk about that. So given that we've talked about some of the integration evidence that we like to see, these also can provide an entry point for us to talk about our research. So my question is where do we start and where do we end with mixed methods? And part of that is, it just depends. Depends on where you want to go. But we do want to be having these integration discussions. And so often in much research, we talk about identifying the research problem as a starting point. Well, what we will often do is, for example, in our health professions research, is we might have something that we want to study. Let's say an intervention that has happened in image. That's a very general one that I think most people can attune to. And it's this idea about, do we actually need to know the reason for integration before we start? Perhaps we don't know. Perhaps we have a question that we don't actually know why we need to integrate. All we know is that we will benefit from perhaps both the experiences and the outcomes of that, let's say, a study on integration. So that's the idea that, do you think we can still get started on the study if we don't know? I would kind of argue yes, although it's not our normal, if we can, conventions of way of going about it. Normally, what we want to do is we want to know everything we can about before we start. Then we want to be able to identify something in order to have a purpose, because that's the way that we've normally done this. But what if we are studying something that hasn't been studied before? What if we're studying something like, let's say, when we first started the COVID pandemic, we didn't have a body of literature in order to be able to go forward. So what we're beginning to see in some of the mixed methods literature is some ideas where perhaps we just have to figure out what we do know and what perhaps things where we can start. But do we actually have to know the need for mixed methods? And I would argue probably not. Another decision that we're making is a conceptual or a theoretical framework. We have lots of different ways that we use theory in our research. For those of you who might be more familiar with quantitative, we might use theory in order to identify variables. Qualitative might be used in different ways. Sometimes we want to generate a theory. Well, in mixed methods, you can use a theory across all of the different ways. But let's say we have an approach that we want to use. So let's say in this intervention work, we have a student-driven approach, and we want to prioritize or we want to have a student-centered approach. We want to prioritize their perspectives over everything else. That actually might drive our need for integration. It might drive who we talk to. It might drive how we actually collected information. So if that's one of the decisions or maybe commitments that we've made, then all the other decisions might be kind of based on that. This reminds me a lot of, I think about this as being like a spider's web. You know, the moment that we step on the spider's web, we might see reverberations in kind of the other decisions that we want to make. If we think about another example would be perhaps a social justice lens for a theoretical framework. If that's our commitment, then that's actually going to influence all the other decisions we make in a design. So again, I think these are different places where you enter into this design. I don't think you have to start in the places where sometimes we've traditionally started. When we talk about research purpose and design, there we're usually talking about an actual design. And in mixed methods last time, we've talked about some of the more known or common designs. We think about in what sequence of data is collected. Sometimes we collect qualitative followed by quantitative. Sometimes we will collect those that kind of data together and actually do a compare and contrast. But it is that idea about if you know how and when you're going to collect your data, then that can be an entry point, and you can figure out other ways. If we think about, sometimes we'll have existing data, or sometimes we'll have access to data or to particular participants. Maybe we know what the problem is, and maybe we know who we want to study, but we don't know the actual design of things. Maybe, so this is this idea about perhaps we know that we want to do interviews, perhaps we know we're going to do a survey, perhaps we know we're going to do arts-based or observational data collection. When we talk here about sampling, what's unique about mixed methods is that we always want to think about the relationship between the samples. And if we think about some of the common ways that the relationship between the qualitative and quantitative, or in our different data collection, it can be matched, it can be nested, so one is a bigger sample than another. We can have a subsample. We can use one data in order to inform our finding of our sample in the other. So perhaps we know who, or perhaps we don't know who, and now we have to figure out where best to find those participants for that problem. We might actually know that we have a particular analysis that we want to do. We might have a particular way or audience for the reporting. So all of these are entry points. Sometimes we're talking about this earlier today, that if we know who our audience is, sometimes the ways and how we're going to report our mixed methods can be a driving force in our design. If it's going to be more qualitatively oriented, more quantitatively oriented, or if we know that there's going to be different kinds of statistics that we need to do. So importantly, we want to have these embedded integration discussions, but we don't always know where to get started. We also don't always know where we're ending, and that often we will actually use this design to actually follow up into another design as we go forward. We might have a larger program of research that is mixed methods, but that we might have qualitative, we might have quantitative studies within that kind of an idea. So these are some of the design questions that we need to have. And so I think designing for integration, if we're talking about integration as being center, does require us in some ways to be perhaps more flexible or more agile in our thinking than what conventions we might have. So we do always want to have plans, and we always do want to attend to this complexity within our conditions. But we actually might have to act in ways and adapt our ways of doing things. And then we need to respond accordingly. And so we can really benefit if we are adopting a little bit of an evolving perspective to our designs. And it's interesting that I use the evolving terminology importantly because there was a time, and there is literature in mixed methods that talks about emergent designs. And emergent designs have been seen with a little bit of skepticism. And there was this idea of we can always do mixed methods if something doesn't go our way in qualitative or quantitative. It's like I can do a follow-up where I can do, it's almost like a saving piece. And really, that's not what we mean. We mean actually intentionally evolving our design and our design details. Now, was there ever a study that you have done that has actually implemented the way that you have planned? Most of us have evolved in different, our designs in different ways. But I noticed there's a huge shift in the conversation since the pandemic, because it is a shared experience in which everybody's plans had to change. And so that it seems to me now that most folks can kind of get on board that, yeah, we live in changeable research conditions, and that there's no longer these assumptions of stability that we used to have. And so I do think that this is a great quote in terms of life is a continuing process for making adjustments and creative responses in a world too complex to be predictable. And so if we think about this, what can mixed methods researchers, and I mean researchers in general, to be honest about this, What do you think we can learn from this? That perhaps we can't always predict how things are going to turn out. That, we do have a piece of a loss of control of this. And so is there a way that we can plan our mixed methods designs in a way that allows us to intentionally take into consideration changeable conditions? Well, how is that possible if we can't actually predict? Well, yeah, sure.
I was just gonna add, like, I think the adjustment of research designs is often seen as the negative, like
Yes.
we didn't get the sample we wanted, or people weren't interested or whatever, but I think emergent adaptive designs are also about taking advantage of affordances. Like, now something's happened and we have this opportunity to generate data in this different way.
It's great.
Or we found out something and now we can follow this path or whatever.
So that's even more important, I think, is that we found out something, or we understood something new, or that we began to understand maybe the system in a way in which my research is happening, in a way that actually can add to the value. It's not always a takeaway, and I think that was a really important comment there, that adapting is not a bad thing, and it's like switching the narrative to that, and making adjustments is actually a natural piece. We always do it, but nobody really talks about it. And I think we're just beginning to see some of those, and we're beginning to see that if we want to do particular research in kind of cutting edge places, or in places that really haven't had the research, these are often the places that actually need the research, but we don't do it because it requires us to go into like uncertainty and things. So I want us to think about how we designed in this. And so what do we know about research conditions? Well, we actually know that they're far more complex than we often will recognize. And I think about, this perspective of a forest. What I wanted to show you here in this picture was just actually adopting a different viewpoint. And so sometimes, we walk into a forest, we're used to seeing the trees this way. Well, what if we lay down and we look up them? So think about that in your own research. Have you taken a different perspective to your research conditions in which you're doing your research? And are there things, I think about this when you lay down and you watch the leaves, move in the wind, and you just see and you notice different things, and you think about, oh, like I wanted to understand the forest, I need to be looking at all of the influences that are coming. And maybe the influences, starts to rain and they're changeable, and if I spend more time there. So that is just another way of thinking about, are we seeing that complexity? Are we taking that complexity into account in our designs, in our thinking, in our data, in our analysis, and even in our reporting? So because conditions will change over time, we also have to remember to pay attention to what has changed, because sometimes, we have actually just caught a moment in time. And of course, health is, as you all know, is a beautiful way of thinking about all the complexity. And we think about, sometimes we think about our learner in one of the health professions as, maybe a learner as part of a group setting. But we don't always think about them as a learner, as an individual, and maybe all the systems within that learner that influence how they've come to that day. Maybe they've woken up late and they've come in quickly. Maybe they got caught in traffic as they got in, they feel flustered as they begin their kind of learning moment. What is it about the conditions that we need to understand? Maybe there's something going on campus that is affecting folks, as they're becoming learning. Maybe something's going on at home. Maybe something going on in an institution or in healthcare within the province and within the country that is affecting their learning environment and their experiences as a learner. So I'm not saying we have to take into consideration all of the complexity, but I think we want to be mindful of those shifting conditions. And even in our reports, perhaps we do have to give a little bit of a lay of the land of what was going on during the time of this to the best of which our ability. And one of the challenges with the work that you do is it involves people. Wouldn't it be easy if you could just, control all the pieces of but that wouldn't be very exciting, right? So people interact with each other. I'm changed by the people that I interact with each day. I don't always realize it, but it is. It's those interactions of their, within my work environment, without my life experiences, the experiences that I have in different things. And so that's kind of where I want to talk about a little bit, is this idea about, can we begin to design and collect data in maybe new ways from different parts of systems that help us as a whole understand. One of the conversations Renata and I had a little bit today was, and thinking about this from maybe even a perspective of multiple studies. So maybe I'm studying this in this part of the system, and my next study is going to be here, and then together, perhaps, I can understand that little piece of my system just a little bit more kind of broadly. And some of this is not specific to mixed methods, but there's an interesting work happening right now around conceptualizing both the mixed methods process as well as how we approach the study of complex phenomena. And so we do talk about this idea about that it involves these interacting systems, that they are replete with social and institutional uncertainties, so we don't know in terms of really what the, really what's influencing them, what they're influenced by. And of course, we have imperfect knowledge about their nature and solutions. So meaning that we don't actually have established ways to study things. And I think that's one of the exciting parts about your field of study in health professionals education, and also probably one of the challenges that you have as well. And that these are the ones that likely need addressing. And so we've been also talking about different frames and different experiences and different ways that we can move our understanding of this beyond simply whether we know something works because of the measurements in which we've been working, or whether people are having a good experience or a poor experience, or whether we can actually, how do we actually address gaps in practical and clinical knowledge in a way that, how do we create interventions or learning experiences, and then how do we actually study their impact in ways that we can understand at the individual level as well as maybe at a clinical and move the field forward. So we're going to apply a little bit about that. And so this is what has happened to me, is that when I've been doing work or I'm working with groups, and we talk about problems that we see in our practice or in our society or in our lived lives, that a lot of folks will talk about, I don't know how to study this problem. Okay, let's unpack it. Where does the problem sit in terms of being influenced by and things like that? Let's unpack that. I don't know where to study this problem. Okay, let's make a list of kind of all the different places where maybe you've seen this. And we talked about this today, that one of the complexities, I think, of health professional education is that your learning happens not just in classrooms. It happens in clinical settings. It happens in you going for lunch. It happens in informal settings. There's all of these pieces where you are, where you get exposure to these different professions and the ways that you might interact in hospital settings as well. I don't know who can best study this problem, so that means, am I the right person as somebody with a background in this, and this? Do I need somebody from a clinical background to help me study this? I mean, how do we form a team when I don't know yet what we need to do? Well, I think that's this idea that we can form teams fluidly and a little bit less, fixed. I don't know what to expect to study outcomes. I don't know what we're going to find at the end of the day, because I'm not sure about really, about what the problem or whether my data collection is actually going to help me figure this out. So all of these are almost like indicators where people have stopped doing research because it's too hard, or I can't figure it out. And it's like sometimes, I also think sometimes our structures get in the way, everything from our funding structures to even ourselves, we get in our own ways. And where I think if you put a number of people around a room and we talk about these things, we can often come up with a design that would help at least us get moving forward. And that's where I hope we can go to a little bit today, and thinking about the qual and the quant that might come together. Many of us are familiar now with this idea about a theoretical framework that's complexity science, and it's seen as a useful theoretical framework. And what they talk about there is that it offers a way beyond going from focusing in on this particular issue to maybe beginning to look at the interdependencies between things. It allows us to look at what's being influenced and what's being influencing, and kind of and pay attention to some of the changes. And that what we see is that we see some mixed methods literature now, and more guidance in the last couple of years about how we can use complexity theory as our theoretical framework for guiding the ways that we are actually accounting for some of those interconnections and the parts, and the ability to adapt to this changeable conditions. And so we've been talking about complexity for a little while. This is not a new theory. And in particular, when you think about health professional education, we've been using the term complexity to describe the nature of the work that you do. It's complex, it's complicated, it's hard. So we've always been acknowledging that those interactions are a huge part of the work in which you do. I was looking at this particular, so this is a new version of a second edition with this idea about messy realities, about how thinking with complexity. And there was quite a change between when the first edition it was written 10 years ago versus kind of now. When I first kind of talked about this idea about complexity about 7 or 8 years ago, people didn't really understand why we would have to look at something more complexly. And now I think our shared experience of having to adapt our designs and kind of adapt the ways that we do research have really brought people on board in understanding that we have lots of interconnections. And then we also see more recently in health professional education that we're using mixed methods in order to study. So both of those things, like we'll call things complex and we'll use mixed methods. But what about if we actually change the way that we do mixed methods, and that we can be guided by and informed by in our data collection and in our analysis by this idea about what we're studying and how we're studying. So one of the things that I see as being is that we have yet to see mixed methods that conceptualize the health professions education as a complex phenomenon itself. So again, complexity theory is an umbrella term for kind of the theories that we talk about, the study of complexity in complex systems. And a complex adaptive system is a special type of complex system that actually, well, two things, and I'll talk about this in a second, but it's where the whole is more complex than its parts. So if we think about conceptualizing, let's say, health professionals education as a complex phenomenon, you're thinking about, and let's go to this, and I'll talk to there's 3 pieces of a complex adaptive system that we know. One of the key concepts is that emergent happens. So we have all of these agents that are working. So if you think about the agents here, these could be instructors, these could be clinical instructors, they could be classroom instructors, they could be learners, they could be your residents, they could be your mentors. So there's people in the system that are interacting with kind of one another. When folks interact with one another together, and if you think about this in the natural sciences, think about this with birds. Birds will naturally work together, interact with each other, and when they fly together, they look like one kind of organism, right? Because they're adapting to each other's kind of idea. So the emergence that's coming out of there is their ability to fly together. So if we think about what is produced by people in the health professions and education systems, what are they producing as perhaps an emergent property coming out of that? Could be competency in a particular area. It could be either an individual competency or a competency in within a group situation. But it is that idea, could be patient-centered care, could be responding to kind of emergencies in a way that is efficient. So there could be lots of things that kind of come out of the system. We have things that are more desirable than kind of other things. So often we're trying to kind of almost direct that emergence and that emergent property in some way, shape, or form. But that it goes to show that each of those systems can be different and they self-organize and that they're influenced by different things. So if you think about the example of, you can teach the same thing to 3 different groups and get 3 different almost outcomes, right? And you have certain things that you might be able to influence and some things that are beyond, your influence. So let's say that, somebody was in a clinical practice and there was an emergency that took a bunch of people away, then that experience for those learners is going to be different, because the conditions surrounding them are going to be different. So it reminds us then about how we have some ways of influencing the system, and we can think about that from our perspective as researchers, when we're researching the things that are emerging over time, but that the system is also being constantly in flux and constantly changing. So if we don't pay attention to those changeable conditions, then we might actually miss out on understanding how the system's working together. The interdependency is this idea that the parts, and this is where sometimes we want to just study one part of it. Well, if we only study one part of a system, then we might, it might either work out or it won't, and sometimes then when we go to apply, and it happens in programs all the time, that after we study something, we think, oh, I should be able to replicate this in this place. And then when it doesn't work, we're confused. Well, if we're not paying attention to kind of the conditions of it, then we can be better, we can better set ourselves up for success. And this idea of an adaptation, good or bad, we're constantly adapting to our changeable environments. So your learners are constantly adapting in good ways, and maybe perhaps sometimes in not so good ways. It just kind of depends on the conditions going around them. So I think about how can these key concepts inform the design of mixed methods as a complex adaptive system? How would understanding about this, or even this perspective or this lens on your research environment, help you think a little bit differently about how you would design? Would it help you think about who needs to be part of your study? Are there folks, when you think about your most recent, that maybe I could have talked to, or maybe would be able to help me understand how that my emergent property that I was studying?
Yeah, I think maybe it invites longitudinal research too, because if you think it invites like longitudinal research too, because nothing is frozen in a moment in time. Rather, you kind of need to understand how things are evolving over time.
And the only way we can understand complicated is almost like by looking at them almost backwards, right? And then of course we can't always predict that's going to happen in the future, but we can at least understand some of the conditions that may be. So it can help us think more longitudinally, and this idea of capturing at this moment in time.
And maybe longitudinal is just one dimension, right? There might be other dimensions that we could look at to try to be less frozen in a particular moment of time.
For sure.
I had a similar thought. I feel like many of the qualitative studies that we've undertaken, we've been guilty of taking a snapshot, or at least flattening it. Most recently looking at professionalism, and as you were pointing out the adaptation requirement, I reflected in my mind, how many different modifications of policy and structure happen within a short period of time to stabilize and lead to emergence of a system that really works? And we missed all of that. Yeah.
But we're also not meant to be, it just helps us to understand from what to almost extrapolate maybe from our data. I mean, that's where we want to be careful in that, right? And so I always say, don't beat yourself up for what was done in the past, but maybe I can take a different perspective as we're going forward, or at least as well, I've really begun to think a lot about the differences, about how we can think about limitations, right? And I'm thinking about limitations in a very different way these days, in that I don't want my limitations in my studies to be my catch-all. I almost want to put them up front, and just be a little more mindful about them, maybe a little more intentional, and maybe owning the limitations of my studies a little bit more, as opposed to being apologetic for them. That's good, it's often where we kind of put them, right? Is at the end.
I've been thinking about this a lot, and I feel like that educationally more likely to find delimitations instead of posing everything as limitations. Sure. I feel like this is an issue, where we end up apologizing for all the things we didn't look at.
Yeah. But this is a study about this other
Like,
thing.
oops,
Only everywhere. Yeah, the limitations are more like, we tried to look at this thing and there's problems with the way that we looked at it because of reality or whatever. And so what about being intentional on the lens? in which we are? On the delimitation and not apologizing for that, just saying, this is the study. This is the feasibility, this is what was possible.
I wonder if we're not ambitious enough. So
Yeah,
a biomedical
Agree with
contrast would be, think about the nurse's study or Framingham or whatever, and say, listen, we're going to put our arms as best we can
Mhm.
around this context, and we're gonna do it for decades. And we have a rough design as to the things we're gonna measure, but as things adapt and change, we're gonna, now, biomedical, so they get one new lab test and that's what they have. That's a big
Yes,
thing for
yeah.
them, because the protocol gets violated. But you do wonder longitudinal, you want to adapt perhaps how you're capturing different types of data and how you might add that to the analysis. But even longitudinal, like, are we going to continue to report out findings and have a system that we're examining over a period rather than saying we're doing a long study, we're doing a number of studies all connected and all responsive to what's happening.
And I think that's where I'd like to see more of even the feedback idea, and you're right, I'd like to see more violations of protocols, because if the protocols aren't, the best we can do, then I think we should be changing them up as we go. But that violates a lot of our current practices, and that's where we kind of have to be aware of that. And, I really do think that it is this idea about the benefit cost analysis, if the benefits to kind of, we don't collect data in the same way. Many of our constructs have evolved over time, but we almost kind of come to like forget that, our social economic status, the indicators have naturally evolved. So why can't our ways of collecting data and our understandings of our systems also evolve over time? So I think that's just an interesting way of being able to think about some of these things. And I'm not saying we have to. I also think that the idea of scope, we kind of have to go, do we want to know this, or do we want to know this? Or do we want to know this, and this, and this, because that's what we can. And so let me just finish up with this idea of, don't forget that in the complex adaptive systems, they're nested, right? So you might have a complex adaptive system of the individual level, and then maybe this is the collection of students and your learners, and they're not all the same. They all have their own systems in there. And are we paying enough attention in some studies to the individual contributions, or at what level are we wanted to integrate data? And just being mindful then about our data sources, where we're collecting it, where we're aggregating it, and then where we're integrating it. And sure, integration can happen across levels, but we want to think about, what's the pros and cons of doing that? Or is there a way that some of our data we want to have in particular groups? What are the groups of nested, of our complex data systems that we're going to do? So I do think that it's important that we recognize just almost like the fractal nature of our systems in which we are studying.
When I look at something like that, I start to wonder about where is the barrier though to keep me in check? Because, at some point I could create a story about world finances, linking to, if I just let myself keep creating linkages across contexts and reasons that, do you have any guidance about creating those?
I think it's about relevance, right? I really do think it's about relevance, and I hope that we're always taking the task a little bit. And here's the boundaries or the delimitations that I set on my study. And somebody says that this happens. I think it happens more when we're talking more openly about it, and when we're having to defend our stuff. When you think about that, there's more conversations that are kind of happening. I wonder if, as we get into and we're embracing in mixed methods, where we're really seeing the kind of interdisciplinary, teams and also these perspectives, that we're going to have both people go, well, have you thought about that? And it'll be like, yeah, tell me, do you think I need to be thinking about that, or is that beyond? And so I do think that that's that idea. I think sometimes we don't include things because we don't think about them or we don't realize. And I think that's where sometimes our perspectives can benefit from others. But I also want us to always think about practicality. Like, and we can't do everything all the time. But let's say we have some existing data, and this is where I think we want to leverage more and more, just even for feasibility reasons, where do we have to be collecting data? And if there is some existing data, taking a look with a critical eye as to what that existing data, how it was collected and from whom and all that kind of stuff. But, is there a way that we can use or leverage some of those things or leverage across our data sets in order to be able to put our resources and our time in the places that are going to be the biggest benefit for our big problems that we're trying to solve and understand? Should we be continuing in the same way? Sure, in some things, but I also think maybe having a new perspective on something might help us to grapple with some of our bigger problems that we haven't either felt equipped to, we haven't felt the need to, or we just haven't been, resourced in order to be able to think that big. And I'm seeing shifts. I'm seeing, as I'm sure you are as well, we're seeing a lot of interesting, even funding opportunities that are either, across, Tri-Council, the discovery grants that are, across all three. We're seeing, so this type of thinking across disciplinary and across even systems, health system doesn't just happen within itself. It happens within the larger, society. And, I don't know if we've, there's been lots of great, of course, conceptualizations, but has there been a way yet for us to change things up? Are we thinking boldly enough yet? And I think we can naturally think about particularly areas like HPE that we really do, and we can see the value of bringing together these different perspectives and perhaps qualitatively and quantitatively.
Strikes me, it's almost a way to keep us honest with scope, because you might overfit your protocol to your data in a self-fulfilling way, and ensuring that the scope is right size keeps us in check. And maybe we're guilty of having too small a scope in much of what we study because we're afraid of the messiness or afraid of being disproved.
Have we ever started, and I've started doing this, when I think of now a problem, I'll actually draw a diagram. I don't automatically go to the problem, I don't automatically go to it, and then I think, I have a magic wand, let's think big, if I could, who should I speak with? Okay, who do I need to speak with first? Or maybe who do I need to, whose perspectives, is a starting place for this. And thinking from this perspective, before I'm even thinking about the on-the ground practicalities about how I'm going to do this. And can you imagine, the different, even in this room, well, we would probably come up with a very different study depending on where we started the study. And if we go back to where we started today, and we talk about, and this is this idea about why I think HPE is would be such a great place to start this type of work. But if we, this is one more. This was just published this week, and this is a line I put in this paper. We were uncertain about how to begin, and I think it's my favorite line so far. And there's over time, emerging evidence pointed to this. So it does talk about, actually in a very authentic way, that this paper in the Journal of Mixed Methods was about how we didn't actually know when we were starting. Can you imagine now how different a design will look? Whether you enter the design here, whether you enter the design with your design, whether you enter your design with your data, or whether you actually start to think about from a systems point of view, where should I begin?
In theory, this is super attractive.
Yes.
In practice, this is very frightening.
Totally.
Because every study that I've ever tried to get too cute with,
Yeah.
it just gets so messy and just so overwhelming, which also may be a function of the methodologies that we try to use. But I think of every conversation I've ever had with an early career researcher or a grad student thing, pare down, get it easier, smaller, get your arms around it.
But what if we thought big and we acted small, but we acted in a way that we could, when somebody said, why did you do that? Well, I did this because of this. And, and maybe, and in a more, I don't know, the systems, like a systematic way, or in a more way of, you know, but the conditions allow me to do this here and now, and this is why. I don't know. So this is just another way of thinking about the design and seeing a design as being not just a planning, but it's also a design carries through the entire research project, where it's also, you're actually at the end of your research, you are justifying why you undertook your research and your design in this way, and actually how your design evolved over time, or whether it didn't, or whether you adapted, or any reason why. So it is that idea, like we talked a little bit about, we're now seeing more evidence of people changing up their study over time, but I'm not sure we're always having access to why. And I'd like to do a prevalence check, but I think recruitment has been a massive issue, and I think it's going to continue to be an issue. But that's not the only issue that people, maybe it's just that we didn't actually anticipate that this would be a better way of collecting data, or that these people we found out were actually our key informants in where we thought it might be with these folks. Certainly in my work, I've certainly had richer data from some places, and I've been surprised by that, and I want to adapt and kind of spend more time there, and sometimes I haven't had the ability to. So, not saying this is, but I think that's an interesting way of being able to think about mixed methods in a way that doesn't mean you have to know exactly what you're doing at the very beginning, but that you're figuring it out as you go along. And one of the things that kind of prompted me to kind of work in this area is, until you see that this is a possibility, then you can't do it. And so, and this is kind of a practice. And so what I want to do now is to put some contributions there so people can use them to also justify the ways that we're doing cutting edge work in places that we don't actually know how to go about this yet. So maybe we'll come up with a few interesting protocols, or maybe at least we'll stimulate some interesting conversations in kind of research teams as well. So I will pause there, and let's, are there any questions here? You can absolutely say, great in theory, doesn't work in practice, but I would actually like to almost take, I'm working on now about how a study might look different depending on where you started and what the possibilities. Does it allow you to respond to emerging opportunities as well, is always my big idea.
I love this idea about starting with all these different kinds of complexity. Do you know what I mean? Because you kind of got interinstitutional complexity, interpersonal complexity, intersectional complexity, millions of socio-material complexities, like how people interact with objects in built environments. And throwing all the kitchen sink in when you're thinking about an issue at the outset, and then figuring out where the starting point is. So intersectionality seems like the main thing here. We're going to explore this, but then we find out that the built environment is a whole thing. So the way that people's ideas come into conflict with the structures around them. And so then your next study chases that kind of complexity. But I don't think, I usually kind of do that unintentionally. Oh, this is too much, I'm gonna do this.
And I think we can all say maybe some of this is new to us, but it is new to some people, all depending on where and how and what orientations and what training experiences and what research experiences they've kind of had. And so I find that a lot of people will work on teams and have very different, and kind of learn over time. But what if we started with this idea of a research problem? And even when we're talking about methodologies, I mean, this requires a fair bit of agile thinking and a fair bit of kind of foundational understanding about the nature of research and kind of different ways of approaching research. So it's just in a different way.
The answer might be read the paper. I was intrigued that you used case study methodology for complex adaptive system. That seems like non sequitur.
So tell me more.
I was hoping you could tell me what it looks like, and the.
Well, so it's super interesting to me that I kind of used a case study design as it kind of fits nicely with being able to put, because by definition, a case study is bounded by time, place, people, right? And so it's almost like it's kind of like the boundary of my system that I'm going to study. And it allows me to almost have a little bit, and by definition, it also needs to be able to draw on different types of data.
Yeah.
So so case studies have always been mixed, if you want it to be, or multi-method at least. I mean, there's some people who have considered them, qualitative or quantitative, but it's been a really, I think, a fertile ground because of the nature of it, and also that we often don't have preconceived ideas. So, we really are trying to understand what has happened during the case. So, and the nice thing about that is the case can be as big or small as you want it to be. It can be multiple, so you can look at almost like different adaptive systems, in kind of an awareness. So I have just found that a really useful and maybe flexible as well approach. And case study is both a method and a methodology is what folks have talked about. And so but I wonder, could we have that kind of flexibility? I mean, there was a time when RCTs, you couldn't do anything with, right? Like it was like they were set in stone and this is the way that's being done. Well, now we've seen a real change, or, I like to say an awakening, but you can decide how that is. But this idea about clinical indicators will tell us one thing, but the experience is also important. So we've seen a whole a change in kind of a methodology that we thought was pretty set. And we don't always have preconceived ideas of what that experience is going to be. There's a fair bit of flexibility in there that we're trying to capture lots of different things. So I think about like, could we look at the system in which an RCT is happening in a maybe a different light? And are there places there and spaces that there's parts of that we're not capturing yet? I don't know. But it's just that's where I think that there could be some really interesting work in that kind of way.
No questions in the chat. Can I pick up this case study thing? It goes back to this conversation we were having earlier today about whether or not mixed methods could be not necessarily qualitative and quantitative mixed. I was wondering if you come across any conversations in the case study literature, or maybe the institutional ethnography literature, or like any of those like sub-literatures that are often qualitative, but are sort of demanding diverse data forms and ones that we don't necessarily always see that could be integrated. So, or if I Google case study integration, would there be a conversation about integrating different data sources in a case study, which are usually like document analysis, there's usually like some observation, maybe some interviews. Is there that conversation happening within the case study?
About it being called mixed methods within that?
No, about integration specifically. Like separated from the other part.
It's quite interesting to me that when we talk about like development of like a case study, I think it's assumed that you'll integrate across. And I know even in some of the work that I've done of qualitative, I've often outlined in terms of how I've used different data in different ways. So I start with here and then I map that on. So it's been interesting to me to see where I've revisited almost some of those concepts in kind of my mixed methods world in a way that's just, different. But I mean, there are folks who have been writing in the case study literature, Robert Ying, who has always seen the potential for mixed case studies. And it was never just qualitative, it was what data was available to understand the case and was needed to understand the case. It was a very, a practical, almost perspective. And I think, although ethnography, there's always been the understanding of understanding that context. And that's where I think we can really, in institutional, ethnography, I don't think they would ever have said you couldn't use numbers, in it. I think whatever, again, help to understand the context and understand, the behaviors of the group would be welcomed in that. It just has been traditionally, more of a narrative description.
I think the overall question is the thing we were talking about earlier is like, why is it so hard to integrate quant data? Why is it so? And then I was mentioning like some of the conversations around like visual data, like getting folks to draw pictures or take pictures or whatever. There's been a lot of struggle integrating those visual data with like interview transcripts or whatever. It just seems like some forms of data we have a lot of trouble figuring, and I want to understand why. is it that we're not used to sharing those forms of data? Is it that those forms of data are inherently hard to pair? Like, because it seems like mixed methods is about focusing on a thing that we struggle to do, but not like value. So I'm trying to figure out where like those, what the overarching problem is for people to do research.
You know, do we go back to the nature and the philosophical underpinnings of the way that we've collected qual and quant, you know? And I mean, I would argue that we could probably, you know, learn a lot more from that as we, you know, you could collect qualitative research more quantitatively, you know, for orientation, you could collect, I mean, we've seen that, right? Where folks will analyze qualitative data, you know, using very quantitative analysis techniques. And so, you know, it's kind of that transformational kind of idea.
I think it's not just a human problem.
Yeah.
It's interesting to
Duh.
see AIs.
Yeah, that's where.
The confluence of multimodal integration is a true computational challenge.
Like when AI is trying to make ants or whatever. Is that what
Well,
you mean?
merging qualitative and quantitative data, merging data that have different structures, sound, and rhythm. And actually, that work to create AI that spans multimodal modalities, particularly in healthcare, has led to enormous breakthrough. And it's questioning, you know, what people do as clinicians that integrate across data sources, because it's always been a computational limitation that, you know, the data that a machine could use to keep a structure. And for it to then merge across two structures is actually computationally its own challenge, and maybe speaks to, which is why I thought about the analogy, which why is it so hard? And you know, I don't think it's just a human problem. But there's also unique benefit there.
But AI is being limited because humans haven't figured it out, so when we're programming AI.
But you know, I mean, one of the prominent AI journals, NHAM AI, published Google's first giant success of this multimodal integration, and the computation that went into trying to solve how to get analysis across data.
I feel like this is it's clinical reasoning issue too, and it seems like over and over again, the qualitative human experience of patients and the problem with their body are very hard to link together. In the decision making you have, in the way that we talk to them, in so many different ways, and I just don't know what the solution is. Like Nikki Woods was doing this thing on, she said that basic sciences, blah blah blah, but she was trying, but the social workers' information didn't fit into any of because they were using a different schema, and she, I don't know if she ever figured out how to reconcile those things, but yeah.
So I think there's enormous potential for the brains in this room and in this field, right? Because you already work every day with these different ways of knowing and evidence, and you're integrating all the time to make decisions. So if you guys can you know, if we can't figure this out in this room, then maybe there's, you know, there is no hope in the future.
No pressure. Thanks for the
Perfect. Thank you so much, Cheryl, again, and thank you to those attending online and here. So thank you. We're done. Thank you.